Hi, I'm Scott Heward. I'm a physical therapist at More Physical Therapy. Today we'll be talking a little bit about dry needling, why we offer dry needling, and some of the benefits. So Austin here is going to kind of allow me to do some dry needling on him. So some questions that we commonly get are how is dry needling different than acupuncture? And I'll show you a needle here so you can kind of get an idea. The needles are very small. They're not like hypodermic needles. We call them monofilament, which means that it is just the needle isn't hollow. You can see it's even flexible. It's small enough that the needle is flexible. And the needle, because of the size of the needle being so much smaller, it generally doesn't hurt as much as a hypodermic needle that you usually get an injection with. The benefits to dry needling is we can target tissue that's underneath. So lots of times as physical therapists we're trying to get to tissue that might be underneath or points that are sensitive that are underneath thick layers of tissue. And the needle allows us to get to those. These are actually the same needles as acupuncturists will generally use. The difference between dry needling and acupuncture is kind of the philosophy behind it. We are targeting specific anatomical structures. We know what structures we're going for and that we want to affect changes in. In typical acupuncture and traditional Chinese medicine, acupuncture is used in trying to alter what they'll call qi or energy flow, and that's not the same philosophy that we're using. We're trying to get to trigger points in a muscle or musculotendinous junctions where muscle and a tendon and bone are meeting, and we're trying to get to those points, targeting them specifically in the arm. Whereas an acupuncturist might be using some needles in your shoulder, your elbow, your hand, your foot, all over the body to kind of alter energy flow. So I'll kind of demonstrate a few techniques that we'll use. So some of the techniques I'm going to demonstrate here are ones we use frequently with lateral epicondylitis, which is more commonly known as tennis elbow. So we'll kind of find that point where we call it the common extensor tendon. A bunch of muscles kind of meet together, form one tendon that attaches here near the elbow. And we'll generally just do one little tap, and it goes in pretty easily. And we'll kind of find the right spot and kind of sink that needle down into that tissue. It's nothing like a hypodermic needle, so sometimes people who have a hard time getting an injection will have no difficulty with doing acupuncture or dry needling because the needles are so much smaller. Some of the effects after dry needling, obviously a big part of what we're going for is pain reduction. During the time of needling, sometimes it can be a little uncomfortable. We'll hit sensitive spots, but generally after dry needling, we get some pain relief. Sometimes people will feel fatigue in the muscles as if they've done a workout, maybe for a day or two afterwards. But those are kind of the general effects, long-term effects.